Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Najah binti Muhammad Zamri and my metric number is 2018806838.
Hi, my name is Nur Ashkiliana binti Abdul Jabbar.
Hi, my name is Nur Shahira Atikah binti Muhammad Izwan.
Hi, my name is Aida Sabrina binti Afendi.
My name is Nur Shahira binti Rasli.
Depression is a mental health problem that increases time to time nowadays. There are various reasons that allow someone to be exposed to depression. First, the cause to someone to be depression is conflict. For example, conflict among family members, friends, or lovers. It can lead to depression if someone have a lot of pressure and can't control their emotion. Besides that, other cause of depression is death or loss. Like if someone lost their family members, friends, or their loved one, it can increase their risk of depression because they difficult to accept that their loved one is gone, or they think that their life has no meaning anymore. Other than that, cause of depression are abuse, certain medication, genetics, major events, other personal problems, and serious illness. In conclusion, many causes can lead to depression. If someone you know have depression, help them or stay in touch and always be there for them.
About types of depression. There are many types of depressions, but I will share with you 4 types of depressions. First, major depression. Some other symptoms you might have: weight loss, trouble getting sleep, feeling worthless, and more. Next is psychotic disorder. People with psychotic disorder have the symptom psycho, which is hallucination, delusions, and paranoid. Third, a typical depression. If you have this type, you have a positive event can temporarily improve your mood, such as increased appetite, sleeping more than usual, oversensitive to criticism, and more. Last but not least, persistent depressive disorder. If you have this type that lasts for 2 years or longer, this type describes two conditions known as dysthymia and chronic nature. If you have this type, symptoms such as sleep too much or little, low self-esteem, change in your appetite, and more.
Ways to raise depression awareness.
There is a lot of ways, but I want to share only two, which is advise people to check up on their own mental health and talk about feelings to encourage others to speak up. We go to the first ways, which is talk about feelings to encourage others to speak up. Most people do not only talk about how they are feeling, especially when they are depressed, making them feel as if they are completely alone. By talking to friends, family members, and acquaintances about our feelings, it will encourage others people to do the same. By talking, it will help reduce the stigma. The second ways or the last ways advise people to check up on their own mental health. We need to advise them to take online screen tests for mental health. These tests are designed to let you know if you should consider getting help for depressions. So for those who want to try the online screening test, you guys can copy the link or just go to the description below. I put the link at there. So you guys can try it.
Other ways to raise depression awareness is talk about it. Having friend discussion about depression, talk about how many people are affected by disease, and let people know that there are treatment options available. And last, watch for bullying. Bullying can defeat a person's self-esteem and cause sadness, hopelessness, and even suicidal ideation. Know the sign of bullying and talk to your children or teenagers about it.
I will talk about symptoms of depression. People who has depression do not all experience the same symptom. It is depends on individual and his or her particular illness. Sometimes you might feel a bit low for lots of different reasons, but this does not always mean that you have depression. The, the symptoms of depression are persistent sad, anxious, and feeling empty. Other than that, you will also feeling hopeless. Next, loss of interest in activities or hobbies you used to enjoy, such as cycling and playing badminton with your friends. Furthermore, you will always talk of suicide or succeed attempts. This is because you feel nobody can understand what you feel and what you have gone through. Last but not least, difficult to concentrate, remembering details, and making decisions. Lastly, if you experience the symptom of depression for most of the day and every day for over 2 weeks, you should go to see a doctor for the good of your health.
Hi, so my thing is about how we can deal with depression people. So first, we can spend time with them because someone with depression have a good and bad day. So they might show they are less interest to going out with ours, but we can build a vibe to them, and we can just check in themselves by dropping a message to comfort them. Second is compassion. Compassion is a really key to someone to recover from their illness. So we can gently to talk their we to asking for their feelings right now. So okay, understanding, we have to understand someone with depression that having a lot of difficult time. So we have take it personally and don't blame them, and we just try to reassuring them. So lastly, we have a patient. Recovering from depression can take a long time. So if they feel better, we can show our support, love, and care to them, and listening to them, and we appreciate them who they are. So if someone want to talk about them, so yeah, just listen, you guys can listening them gently. So thank you.